The Kenyan journey towards an HIV-free society has been long, yet rewarding. It started in earnest in 1999, with the government of Kenya declaring HIV a national disaster and the subsequent establishment of the National AIDS Control Council to coordinate a multi-sectoral national response. At the time, Liverpool VCT Care and Treatment, LVCT, was conducting a research on the feasibility of voluntary counselling and testing, VCT, in public health settings as an HIV prevention strategy. This operational step formed the adoption of VCT into the first Kenyan National AIDS Strategic Plan. Prior to this, HIV testing was primarily done by technologists at laboratories in major hospitals, with no counselling and results to 2 weeks to deliver. The costs were prohibitive. LVCT championed the change of status to utilise lay counsellors, providing rapid HIV testing and availing counselling in a context where there was no medication for HIV and stigma was high.
We piloted the first use in Kenya of HIV rapid test kits outside of laboratory settings. So obviously that had two impacts. One, you were removing testing from the laboratory, which then allowed for a massive scale-up of testing because then you could reach many more people. And secondly, you were also removing testing away from ELISA, what you call either the Western blot or long ELISA, which meant that people had to wait a week or they got their results, into a 30-minute waiting.
By 2003, LVCT again utilized research to test the feasibility of increasing coverage through developing and implementing a national quality assurance system. They did standards for registration, licensure and accreditation of VCT sites, quality control for testing, counselor support supervision, client satisfaction interviews, and a national data collection and reporting. The stage was set for the scale-up of VCT services.
Everybody wanted to set a site within the health facility, in the community, you know. There was a big drive in the scaling up, and it was very, very exciting.
Standalone VCT sites in non-health facility settings were started.
2001, a research study was undertaken by LVCT to check on the quality assurance in VCT. And basic assurance was able to support in the processes of scaling up of VCTs so that standards could be developed, and then every other facility that is providing VCT services could be able to respond to that.
The National AIDS and STI Control Program National Quality Assurance Team, where LVCT was secretariat, enforced these standards, resulting in over 1,000 VCTs in 2008, up from 3 a decade earlier. With the advent of antiretroviral therapy, LVCT began to deliver HIV care, support and treatment services within the VCT clinic. The innovative VCT Plus model has demonstrated up to 97% referral uptake for HIV treatment. By 2005, feedback from LVCT counsellor support mechanisms indicated challenges in responding to various clients, such as men having sex with men, survivors of sexual violence, and people with hearing impairment who were not verbal mass media communication. LVCT responded by piloting 3 deaf VCT sites and training 15 counsellors, 11 of whom were deaf, in VCT-related sign language. This pilot won the International AIDS Society 2006 Young Investigators Award and has served as a basis for advocacy on disability and HIV in Kenya and internationally. LVCT's response for HIV prevention amongst men who have sex with men created in 2005, following analysis of service delivery data, which revealed that prevalence within this population was 3 times higher.
Men who have sex with men do not necessarily identify as gay. But we then began to look at how do we reach out to this group. They're hard to reach, they don't get information, it's highly stigmatized, and so we began our MSM work, and we started a comprehensive men's health clinic in 2005 and eventually integrated that into many services.
The program included a unique approach directly engaging peers of men having sex with men in mobilization for HIV prevention and care services. LVCT utilized prevailing evidence on HIV in prison to provide technical assistance to the Kenya Prison Service for VCT services, strengthened quality assurance, and data management. Youth uptake of HIV testing was challenged by the different sexual and reproductive health and information to youth. LVCT responded through the innovative toll-free one-to-one youth hotline that utilized information, communication and technology to deliver counseling and referral services. To respond to survivors of violence, LVCT tested and evaluated a model for the delivery of post-rape care services. This pioneer model and ongoing research integrated the delivery of medical legal examination and documentation, HIV exposure prophylaxis, and emergency contraception and testing into public health settings for the first time. This model was then adopted by the World Health Organization and the Department of Reproductive Health in Kenya. Despite increase of VCT services, challenges were experienced in repeat testing, reaching hard-to-access populations, long counseling periods, and limited linkages to HIV care and treatment.
We had this there's a pre-test and it goes up to minutes. We had the testing, and during the testing period, do you know, surprisingly, counselors used to sit, keep quiet. You didn't say anything to the client for 15 minutes. Hey.
LVCT once again championed shifts in approaches to testing. There were no missed opportunities at workplaces and in homesteads. Counseling time was shortened, and client names were used to strengthen referral to care and treatment. This was made possible through the revision of testing guidelines by NASCOP, while LVCT provided Secretariat support. Piloting
of the short protocol by LVCT was very critical for scale-up of HIV testing and counseling services in Kenya. This was piloted with a view of maintaining quality of all the essential components of the quality of the intervention, while reducing the duration of the intervention from 45 minutes to 30 minutes.
LVCT piloted the new HIV testing and counseling guidelines. The results were shared and adopted in an accelerated campaign of 2007 and subsequently adopted by all providers nationwide. This paved way for scale-up of other strategies such as home-based, workplace, mobile and moonlight. LVCT did celebrity testing by partnering with influential persons to drive HTC service uptake within their constituencies.
So one of the things that we're here in front of this band to do today is my wife and I are going to get tested for HIV/AIDS. Because if you know your status, then you can prevent illness.
In the 3 months that followed this event, LVCT realized a 57% increase in HIV testing and counseling uptake compared to 3 months prior. Through various partnerships with the National AIDS Control Council, the Private Sector Partners Association and NASCOP, LVCT has tested celebrities in politics, the private sector, the Chief of General Staff, and other public figures. Additionally, LVCT facilitated the development of a training curriculum to provide new skills and procedures to counsellors, including the development of a specific curriculum for delivering services to couples. LVCT utilized research to explore the feasibility of routine HIV testing and counselling in facilities to ensure early detection of HIV and facilitate entry for all HIV-positive clients into treatment. The LVCT-supported, provider-initiated testing and counselling model resulted in scale-up of PITC services from 2 facilities in 2008 to over 40 government health facilities, providing services through which 260,000 people have since been tested. LVCT began a process of mentoring other local organisations based on our experience to improve coverage. This mentoring has since included support for financial and organizational systems and overall institutional growth.
I'm living positive, and it is because of this support I got from Liverpool which has kept me moving. And actually I'm using the same speed they have to be an ambassador of hope.
The efforts of the government of Kenya, LVCT and other partners were reflected in the Kenya Demographic Health Survey 2009. Since 2003, the number of people ever tested for HIV has grown by 4 times. LVCT is honoured to be contributing to this country-level impact, having tested 2.4 million people and training 75% of Kenya's VCT counsellors since 2001. Of the 350,000 people on HIV care and treatment in Kenya, LVCT contributes 6%, offering laboratory for decentralised services and tracking referrals through the community strategy. LVCT's pioneering response to vulnerable groups and most at-risk populations has seen delivery of HIV services directly to 8,005 inmates, 1,400 prison officers and civilians within prisons, 2,900 men who have sex with men, 9,000 survivors of sexual violence, and 1 million youth. Celebrating the achievements of the journey towards an HIV-free society, LVCT's work is gaining momentum. Keeping in line with her mission, LVCT will continue to focus on research and piloting initiatives, policy advocacy, and system strengthening as defined by the World Health Organization framework. Further, LVCT will consolidate experience so far gained, contribute at policy and service level Kenya's attainment of universal access for knowledge of HIV status as outlined in the HIV testing and counselling roadmap, strengthen the quality of HIV testing and increase uptake of treatment referral, ensuring integrative sexual and reproductive health care, continuously refine our capacity development model to impart our experiences to other local partners, consistently undertake a gender-responsive and women-centered approach to programming, data analysis and interventions, continue applied and operational research to respond to national and international priorities and gaps in the health and HIV response with strengthened dissemination, develop partnerships with private sector providers to competencies, technical and financial resources and infrastructure to facilitate coverage of HIV services, strengthen peer-led HIV prevention, care and treatment initiatives among vulnerable and most at-risk populations, continuously refine our organizational management to enhance efficiency, value for money and optimize results. LVCT's work is guided by integrity, respect, quality, transparency, accountability, equity and commitment to service. Join us in building partnerships and transforming the lives of Kenyans.